just woke up one morning and decided that I wanted to have a pierced needle.
I just like the way it looked, I guess, yeah.
The only thing it's hard to do is kiss at the moment. Because
Body piercing is the fashion statement for the 90s, and almost no body part is sacred. But if you're one of the thousands that does it every year, then there are a few risks that you need to know about. One-time rock wild child of Fiona Horne knew the risks but wasn't prepared for the pain.
It was really painful when it was done. It was like, when it was done, I thought, oh, what am I doing? Like, it was hideous. The pain was a split second, but really, it seemed to last forever as it went through. And I thought, oh, God, this is mutilation. What am I doing to myself?
And there are other problems.
My dentist freaks out. He thinks that I'm an idiot because it's rubbing away at my gums. The flat base has actually eroded my gum a little at the front, the two front teeth.
Pop these clamps on, okay, and these are sterilised, so we sterilise everything that we use. And the piercing needle I'm going to use now is actually single use. Right, we use that once, then throw it away. Okay.
Even so, nipple piercing has its own complications. There'll always be scar tissue, and for women that means milk ducts could become blocked and create problems later with breastfeeding.
That's it, well done.
How does that feel? I can feel it. Like agony?
No, not agony, but
Very
just
brave.
it's a lot of pressure.
While infection is the most common risk with this procedure, some doctors are particularly concerned with the fad of tongue piercing.
Pop your tongue out again, that's it, and keep it out as far as you can.
The tongue is a very important muscle. It's full of blood vessels and nerves. There's a danger of bleeding occurring, and there's also a very high risk of infection.
Okay.
The Australian Dental Association certainly doesn't recommend that anybody has any piercing done in and around the mouth.
If you're thinking of getting a body piercing, then there are a few things you need to keep in mind. Always get it done with a practitioner who's registered according to Department of Health guidelines. Never ever do it yourself. And if you see any signs of infection, like spreading redness or discharge, then see your doctor for advice.